Okay, so good afternoon, everyone. Thank you for joining in today. Thank you for those of us who joined in on time, and for those of us who are just joining in, you're very welcome. It's nice to see where everyone is from. We have a range of people here. I'm seeing Kebbi State, Port Harcourt, Oyo State, Abuja, Umahia. You're all welcome. Thank you for joining us today. Good afternoon. My name is Christine Bestman. I am the Mental Health Thematic Lead at the Leprosy Mission Nigeria, and I'll be moderating our session for today. Before we begin today's session, if we can please all take the national anthem. Okay.
O God of all creation, grant
Grant
this our one
the request.
request.
Help us to
Help
build a
us to
nation
build a nation
where
We
no
where
man
no one is oppressed,
and
and
so
so
and plenty.
peace and plenty Nigeria may be blessed.
Thank you, everybody. And now on to our opening remarks. If we can please welcome the chair of the National Task Force for the Decriminalization of Attempted Suicide, Professor Cheluchi Onyemelukwe, for her opening remarks. You're welcome, Ma.
Thank you very much, Christine. Thank you, everyone, for joining us this afternoon. We appreciate your time. We appreciate your making time out of what I know must be busy schedules to join us for another webinar on our webinar series on decriminalization of attempted suicide in Nigeria. My name is Chaluchonya Malukwe, as has been stated. I am the chair of the National Task Force on decriminalization of attempted suicide. Christine, I'm not sure if she mentioned it in her opening statement, is also a member of the task force. Over the past a year and a half, we have been working to ensure that we decriminalize attempted suicide. We were established by the Honorable Coordinating Minister in late 2024. And since then, we have developed a white paper looking at the pros and cons of continuing to criminalize attempted suicide, and as well as done a few other things, engagements with different stakeholders at different levels. We thought it wise to have these sorts of webinar series to have conversations with the wider society. And this is our third edition. We've had two other editions which were very well received, highly impactful, where we've had different sorts of conversations around suicide prevention, etc. For this particular webinar, we are looking at youth engagement, youth involvement, inclusion of youth as part of the voices we want to hear with regard to suicide prevention and specifically with regard to the decriminalization of attempted suicide in Nigeria. As I'm sure will unfold as we continue to speak, we know that youths are disproportionately affected by suicide attempts and completed suicides in Nigeria and all over the world. And who better than to speak about the issue, to advocate for the issue than youth? And so we thought we would have this conversation with youth, talking about youth situations and circumstances. And I welcome you to this edition, hoping that we will take something out of it. And I'm hoping that we have quite a number of young people in the room. I've seen quite a number of people, and I thank you for joining us. And hopefully, as we push, we will succeed. Actually, we've received some information that shows that we're making really good progress. And again, we hope that you come along this journey with us and that we begin to change the narrative around suicide attempts and recognize that we have this public health concern and begin to look at things from a human rights lens. Thank you again for joining us, and I hope that you find this series meaningful. Thank you so much, Christine. Back to you.
Thank you, Professor Cheluchi, for that introduction to both the work that the Decriminalization Task Force is doing, and also the progress that we've made so far. Before we go further into the session, I just like to state a quick trigger warning for our participants today. Today's session will be discussing suicide and we'll be discussing mental health. And if you need to take a break or step away at any point, please go ahead and do so. If you or someone that you know requires any support, if you look on your screens, you'll see our 24/7 helpline that you can call to receive support at any point. I'd also like to add that the chat box will be monitored. So if you have any thoughts, any questions, any comments, please go ahead and put these in there, and we will be going through and discussing them as the session progresses. So Prof has already said a lot about why we're here, but I'd just like to add a few things before we go into the next session. So like Prof mentioned, for over a century, a young person who survived a suicide attempt in Nigeria has faced prison a lot of times rather than the kind of care that they need. And we hope that with the work the task force is doing, that's changing, and we've seen that that is changing. The work that we're doing is working to ensure that punishment would be replaced with a public health response that includes care for the people who are affected. But changing the law is only a part of the attempt and is only half of the picture. We also need to talk about what helps the young people before they even reach the point of considering suicide. And so today our discussion would hold both. We'd be looking at both decriminalization as well as prevention. And like Prof mentioned, we intend to be doing this with you as young people and not just talking about it. So we intend for the session to be very interactive. Please, like I said earlier, put your thoughts in the chat, any comments, anything that you'd like to say, really. And we'd be very happy to read these responses as we proceed. So let's go ahead and get started. To warm up, get everybody talking, I've been going through the chat. I see all of us are letting us know where we're watching from, where we're joining from. Thank you for that. We'll just be starting with a quick Mentimeter question. And please, if you have any thoughts about this question, if you have any things you'd like to say about this question, please put this in the chat box and I'll be reading this. So our question for today is, how have young people sought help when they're in crisis? If you look on the screen, you'll see the code up there for the Mentimeter. You can go ahead and use this code to put your responses in, or if you're having trouble doing that, you can go ahead and put it in the chat box and I'll read from there. But like I said, our question is, how have young people sought help when they're in crisis? It can be from what you know, it can be from what you've experienced, what you've been told. How do you think that young people have sought help when they're in crisis? We'll be looking forward to your responses. So it could be in terms of the kind of people that they reach out to. Do they, turn to appropriate resources available? You can even maybe discuss how accessible those resources are. How do you think that young people have sought help when they're in crisis? Mr. Abdisalan, please permit me if I'm not pronouncing your name properly. I noticed that you have your hand up. If you have a question or a comment, please go ahead and put this in the chat box and we'd be happy to respond to you. So how do you think young people have sought help when they're in a crisis? Do you think they have? It could be that from your experience and from what you know so far.
Hello, thank you very much. I'm happy to join for this meeting for talking about the youth engagement for issues which related for the mental health and discrimination of the child. And in my side, my name is Abdulsalam Sheikh. I'm from Somaliland, especially city of Boroma, Awdal region, in the north of Gulf of Aden. And participation for this and mindset of the area, which and we wanted to increase the capacity of the community, and it is the first thing is the engagement of the community. If the community engaged for the public health issue, which is related for the young children, discrimination and the mindset, we wanna able to collect a lot of information which related for the younger children, those who have a suffering for the mental issues and discriminations, and also some are maybe is still they are stage of the initiation.
Yes, sir.
Therefore, we can help the community, and
Mm-hmm.
also we refer from the hospitals. And
Mm-hmm.
thank you very much. And
Okay.
although I would like to participate for an session for my topic, but
Yes,
at
sir.
now I would like to end my topic. Thank you.
Thank, thank you. Thank you very much for sharing, sir. Thank you. Okay, so if we look at some of the responses that we've gotten so far, we have here that sometimes we feel like young people withdraw, which I have seen. In the chat box, we see here that someone says people resort to their church. Yes, a lot of times spiritual leaders become the first point of contact for a young person who feels like they might need to seek care. We have a comment here from Alexander Comfort, and she says, in my practice, I've noticed that a handful of individuals turn to legal and illegal substance use, sex, and peer-to-peer conversations. And that is true. I've seen that as well. We see here from Emmanuel Diala. He says, with my experiences so far, young people prefer reaching out to their pastors. That's true. For those who are faith believing, you find that they reach out to spiritual leads or pastors in churches to seek help. Okay, Gabriel Samuel says it depends on the individual. And he says if the individual is someone whose parents have created an enabling environment, then that young person will go to the family members first. On the contrary, if they don't have that enabling environment, I guess the person seeks other options like friends, co-workers, or even decides to keep it within themselves. And that's true. Like Mr. Abdi Salan was sharing earlier, it is, you actually have to take into consideration the community and the access we have within the community for these young people to not only speak about their struggles, but also access the care that they think they need. Okay, Mr. Isaiah Usman, who's joining from Borno State, says people seek from trusted mentors. Stephanie Johnson says many, including herself, turn to self-harm, and that's true. So I think we've seen from a lot of this comments that people do try to seek help, especially young people, in one way or another. We've seen that sometimes it might not be in the best way possible, but we see that help is sought. And so that points us to the fact that help is needed, because if help is being sought, then we can recognize that help is needed. And we want to ensure that these young people and people facing suicidal thoughts and ideation are accessing the right kind of care. Okay, we have one more comment from Solomon Jephthah, who says, young people speak only to their perceived safe groups. Indeed. So that only buttresses the point to say that young people do try to seek help. But sometimes even that help seeking isn't enough. For example, in June of this year, 2026, we saw the story of a young woman named Favor from Delta State who died by suicide after she was allegedly sexually assaulted by a content creator. I'm sure a lot of us who are, keep in touch with content and social media would have seen this story. And this content creator had invited her to Asaba under, false pretenses. She went home, she told her family members about what she had experienced, and even recorded her story and posted online. But Favor didn't survive. Her case sparked national outrage, and since then an arrest has been made, although the investigation is still ongoing. And it just goes to show that Favor's case and Favor's situation is exactly why these kind of conversations we're having today matter. Because sometimes you do find that people are seeking help, but the help is either not coming timely enough or the access is limited, and that still results to death by suicide. And so decriminalizing, like I said, is only the first attempt to doing this. We need young people that need real pathways and help, both during and after a crisis. So thank you, everybody, for sharing your thoughts. I hope that this will continue. You'll continue sharing your thoughts as we go through. With that being said, if we can please go on to meet today's presenter. Our first speaker for today is Professor Olayinka Atilola. If you can just give me a couple of minutes, I will be reading his profile. So, Professor Atilola is a registered medical practitioner in Nigeria. He's fully registered under the Medical and Dental Practitioners Act. He's a trained psychiatrist with specialization in child and adolescent mental health. He is a fellow of the Medical College of Psychiatrists of Nigeria, as well as a fellow of the West African College of Physicians. Aside from his training in Nigeria, he received complementary training outside Nigeria in different aspects of assessment and treatment of child and adolescent psychiatric disorders. He's an alumnus of the Children and Youth Studies program of the International Institute of Social Studies in The Hague, Netherlands. Professor Atilola is a professor of psychiatry with an interest in child and adolescent psychiatry. And in the course of his academic and professional work, he has been involved in training and design of child and adolescent mental health services at various levels. Please let's welcome Professor Atilola as he speaks to us today about the decriminalization of attempted suicide and some of the work that he does. Thank you. Prof.
Thank you very much for the very nice introduction. I had to look at the slide closely, wondering whether it is me that they are describing. I will want to share my slide. I'm hoping that I'm able to do so. Now, is my slide, can you see my slide?
Yes, sir, we can. If you just put it in presentation mode so that we can see it clearly. Thank you.
So that is what I want to.
Yes, sir. Thank you.
This is good. Okay, thank you very much. I have very limited time, and I will try to run through this as fast as I can, but I will also try not to miss any of the important message. I've titled this conversation, Suicidal Behaviors Among Nigerian Youth, Understanding the Burden, the Why, and Why Your Voice Matters. I've been earlier introduced. My name is Olayinka Atilola. And I will start with this because sometimes to have a meaningful conversation about any topic, more importantly, mental health topics, it's good that people are able to imagine what we are talking about. So imagine a 21-year-old university student who fails an examination after months of depression. So this university student started feeling hopeless and he attempts suicide but survives. For example, even if we are not using this example, if we use the story that we were told earlier, the unfortunate story of the young lady who died by suicide some months ago, let's assume that such a person survives. Instead of receiving the counseling and the treatment that they need, imagine that such a person is arrested and is somewhere in some prison cell or police station awaiting prosecution. Of course, we can all imagine that that is just going to further complicate whatever was the original psychosocial problem that contributed to the attempted suicide in the first instance. So why are we having this conversation after we have imagined that scenario? By the end of today, you should understand that suicide is a public health issue and not a crime. And you should be able to understand why many young Nigerians struggle and why people attempt suicide and why criminalizing attempted suicide causes harm than cause any good. And you also be able to see how young people like you can become advocates for change. What are the facts? Again, I try to make the conversation simple because my audience are mostly lay persons, even when there might be a few professionals in our midst, but I try to keep it simple. Every year, more than 700,000 people die by suicide worldwide. And suicide is among the leading causes of death in young people aged between 15 to 29, meaning that among the age bracket of 15 to 29 years, if you hear that a 15 to 29-year-old dies, that suicide is one of the most common reasons why they have died. That is a very serious issue. And for every suicide death, many more people attempt suicide. So when we are counting the number of people that died by suicide, we have not started counting the number of people that attempted but survived. What statistics show us is that for every completed suicide, at least 4 people have attempted. So when we are talking about the issue of criminalization, this can give you an idea of how many people are affected, because the people that are criminalized mostly are survivors of suicidal attempts. And in Nigeria, thousands of Nigerians die every year from suicide, and many more attempts are never reported for the same reason of fear, stigma, and criminalization. The truth of the matter is that even to collect statistics about attempted suicide in Nigeria, to even know how to plan, is impacted by the fact that what you are collecting statistics on is supposed to be quote and unquote illegal. So for that reason, a lot of people don't even report attempted suicide for the purpose of getting some help or gathering data. And so a lot of time we don't even know what the number is. We only estimate it from the realities on ground. What do we mean by suicidal behavior? So I choose that word carefully because a lot of time when people talk about suicide, we talk about the last phase of it, which is actually dying from suicide. But suicidal behavior is a more encompassing terminology because it captured the wide spectrum of suicidal behavior there. Thinking about ending one's life is a suicidal behavior. Even when you have not done any, just thinking about it. Making plans to do something to harm yourself is a suicidal behavior. And attempting suicide is a suicidal behavior. And dying by suicide is a suicidal behavior. And you can see a spectrum. We start from thinking about ending one's life and ends by dying by suicide. And for many people with suicidal behavior, they actually go through each of these steps. As in, many people that died by suicide actually went through this whole step. Initially thinking about ending their own life, making plans, attempting the suicide, surviving it, and attempting again, and eventually dying. And it is the people that you can help are the people that are on the earlier end of the spectrum. People that are thinking about ending their own life, people that are making plans, people that have attempted. But because of this whole criminalization issue, sometimes these people at this early end of the spectrum that could get help are not even able to get the help that they need. And it's important to note that not everyone who think about suicide wants to die. Often, what a lot of people just want is that they want the emotional pain that they are going through to stop. And they conceived death as one of the possible escape from it. They want the problems that they are going through to end They want a sense of hope to return. But these are things that can happen. Emotional pain can stop, problem can end, hope can return when intervention is put in place. But of course, if intervention is not put in place, people can progress and then they can die, even when they didn't want to die. They were only looking for some kind of help. And why are Nigerian youth vulnerable? What are the vulnerability points? Again, we use Nigerian youth, but again, it's not extremely different from that demographic around the world. Academic pressure is one of the vulnerability points because again, in school, there are ways by which the society is structured. Sometimes it could be due to parental influence, overemphasis on academic excellence and creating a competitive environment, even when everybody is thriving. But then we are thriving within competition. And of course, unemployment is a big issue for young people. I mean, finishing school, not finding anything to do, financial hardships, relationship problems, of course, because young people, one of the things that is a source of um, motivation and happiness for young people is being in some form of relationship or the other, especially romantic relationships. And of course, relationships also come with their own problems. And then when that is broken, it's one of the vulnerability points. Then family conflicts, things that's happening within the family, parental crisis within the family, being witness to domestic violence, unstable family, and then bullying in school, bullying at work, and of course, the big one, social media pressure. There's a lot of reflection of the reality, but which people have imbibed and is putting them under a lot of pressure. Furthermore, other things that serve as a vulnerability point for young people include drug and alcohol use, mental illnesses like depression, anxiety, and the rest of them, loneliness, violence, and insecurity, especially in certain regions of the country where it is gradually becoming a daily reality for one form of violence or insecurity or the other. And then loss and trauma, traumatic events happening to people, being victim of some form of abuse, being loss of money to maybe some scheme or some fraudster and all of that. All these things happen. So what happens inside the mind when people are going through emotional difficulties? There are thoughts such as, I am a burden. No one understands me. Things will never get better. I have failed. My family will be better without me. These are thoughts, and these are the thoughts that are the precursors of suicidal behavior. But then there are some myths and there are some facts about suicide. People think that people talk about suicide as seeking attention. It's not always true. Talking about suicide is often a cry for help, and it should not be seen as just seeking attention. And another myth is suicide is selfish. Suicide usually results from unbearable psychological pain. It's not a selfishness. If you have never stepped into that situation, you will not understand how painful that psychological pain is. Another myth is people think that asking someone about suicide plant the idea in the person. It's not always true. When you ask kindly about thoughts relating to suicide, it can actually save a life because people have actually opened up when they were asked. And another myth is that people think that strong people don't become suicidal. I've heard this even myself from my own colleagues. I mean, when I say I'm my own colleague, I mean doctors who are not in mental health practice. And this is a big fallacy, and it's actually a disservice to those who struggle psychologically, because anyone can struggle. The only thing you need to be suicidal is that you need to have a brain. And when the circumstances, negative circumstances, align in a cruel way for you, anybody can struggle. There's nobody that is strong. And what is the Nigerian reality? Attempted suicide is still criminalized under the Nigerian law, as we will be talking more later. What happens? People become afraid to seek help. Families hide the problem. Friends keep silent. Healthcare is delayed because you don't even know what will happen if you go to the hospital, and lives are lost in that process. And that is a reality. And so, why does decriminalization matter? Decriminalization does not mean encouraging suicide. It only means treating suicide as a public health issue that it is. It means reducing stigma around suicidal behaviors. It means encouraging early help seeking. It means protecting human dignity. It means improving access to care, and it means saving lives. And what can young people do? People like you, be a safe friend for people, listen to people without judging, and taking suicidal statements seriously. People don't joke about suicide. People can write it on their social media page that I'm thinking about ending my life. And I've seen people who just be trolling the person that, look, you're not going anywhere where you need to get that. If you people voted Buhari, if you people voted Tinubu, but that is someone talking about a very serious emotional issue that is potentially life-threatening. And then encouraging people to seek professional help rather than taunting them, challenging harmful myths around suicidal behavior, speaking against stigma, supporting policies that prioritize care over punishment, and using your voice responsibly online. There are things to say, there are things not to say. If someone says, I'm tired, I can't go on, I wish I could disappear, don't say things like you are looking for attention, or say things like pray harder. I mean, they probably have prayed, and when they speak out, what they are looking for is understanding and help, not another go back and pray more. Others, and things like others have bigger problems. Yes, you may have a bigger problem, but you have a higher resilience than the other party. The other party's resilience is no longer able to carry what you consider to be a smaller problem. And again, stress is cumulative. The fact that somebody have a small problem now does not mean that what it means that they may have handled bigger problems too often, that a smaller problem is now burning out their resilience. And instead, say things like, I'm glad you told me, I'm here for you, let's get help together. All these are ways by which you can also help and join the conversation. So what are the key takeaways? One, suicide is not a crime. It is often the final expression of unbearable emotional pain, and that young people have the power to replace stigma with compassion, replace silence with conversation, replace punishment with care, help build a Nigeria where asking for help is safe, and let's lend our voices not to judge those who suffer, but to protect them. There's this saying that keep your chin up. No one expected you to save the world. Otherwise, you will have been born wearing a cape and tie. But just do the best that you can. Just contribute your own quota. We are not saying go out there and solve all the world's problems, but be part of the solution in your own very little way. And if all of us do those small, small things, it coalesces together and become a big change. Thank you for being a wonderful audience. I will stop here so that the actual conversation for today can actually start. Thank you very much.
Wow, wow. Thank you so much, Prof. Thank you. Please, our audience, those of us who have joined in, please, if we can just give virtual claps to Prof for laying that foundation for us. I'm sure that there's some things he spoke about that we hadn't really thought about. So even if we had, he'd brought it out in new light. I know for me, one of the things that Prof said when he was speaking is we often assume, or you've heard people say strong people don't become suicidal. And with when Prof was speaking, it then made me realize that well, when he was speaking, he mentioned that the only thing you need to become suicidal is have a brain and be in the right circumstances that can cause that kind of ideation and those kind of thoughts. And that really just brings into perspective how real, the issue is, and not very far removed from us as a lot of us might think it is. It goes back to what he was saying at the end about replacing stigma with compassion and just thinking about how this is a real issue that real people, even strong people, are facing. So thank you so much, Prof, for sharing with us. Please, at this point, if you have any questions for Prof, before we go into the next section of our talk today, if you have any questions, any comments, please, you can go ahead and put that in the chat. I'll be reading that. I also have a couple of questions for Prof myself. But before we do that, another thing that Prof spoke about was the language we use when we're speaking to our peers, when we're speaking to our friends, and even the public. And I'm sure a lot of us have heard, or maybe even some of us are guilty. I won't say let's put our hands up. Please take note of the fact that I use the word guilty. It's very intentional. I won't ask anybody to identify if they do. But I know that I've met a lot of young people, and even with the amount of awareness they have about suicide and the issues that cause suicide, the language that we use when we're speaking about suicide is still a bit problematic, especially when you look at why we're here today and what the work of the Decriminalisation Task Force is. So I'm sure a lot of us here have said have used the term committed suicide, and if you'll notice, a lot of our speakers today, those that you've heard from and those that you're here to hear from, will not be using that language. You'll hear different iterations, but a lot of times what we'll say is died by suicide, and that's just because committed is the language for crimes. You commit a robbery, you commit a theft, and using that kind of language is kind of like a holdover from what the task force is actually trying to change. And so I just like to place that out there and encourage everybody joining us today to please think about the language we're using. So rather than saying committed suicide, you can say died by suicide. Changing the language is also part of changing the law and raising the awareness that we choose to put into the world today. So thank you. Like I said, please put any questions that you have for Prof. While we're waiting for questions to come in, Prof, I have a question for you from myself. And my question goes, from a psychiatric standpoint, what does the current law get wrong about how a suicide attempt in a young person works or should actually be understood and responded to? So I'll repeat, from your psychiatric perspective, what does the law in Nigeria today get wrong about how a suicidal attempt from a young person should be understood and responded to?
Well, thank you. I think the misconception that the legislative members of whatever the time that that law was put in place was that they understood from the angle of the fact that somebody who tried to kill themselves was doing so willfully, and that it is some kind of disrespect for human life, and that it's seen as you have taken a life, even if it's your own, that you shouldn't have taken the life. Now, not understanding it from the angle of the fact that there is a certain situation that someone can get to and that life can become burdensome, such that the individual is unable to cope with living. And because the pain is so unbearable, they want to escape from it. But so rather than see that as a situation where we need to help someone, the crafters of the law saw it from a situation where we need to punish them for doing what they consider was wrong. And indeed, if you are using a non-suicidal brain to view suicidal behavior, I can excuse that you will think that way, that look, we're in this together. Why will you do that? You are not even thinking of your family. You are not even thinking of, because your own brain is not suicidal. And what the message I always tell people when I hear that is that pray that mental illness, especially the type associated with suicidal behavior, does not branch into your brain. That if it does, you will, and I pray you don't, appreciate how painful that situation is usually for people that find themselves in that space. So those who put in that law were using their non-suicidal brain to understand suicidal behavior, and they saw it more from a point of wrongdoing rather than a situation that is sometimes beyond the control of the human person.
Thank you for sharing, sir. Thank you for sharing, sir. I think that also answers one of the questions that was put in the chat. And Gabriel was asking why attempted suicide was historically criminalized in many countries. And like you said, Prof, you said it indicated maybe like a loss of value in life, which people will often think is wrong. And rather than wanting to help, punishment for that loss of value is what was leaned towards. And that's why those kind of laws existed and continue to exist today where they do. If you have any other questions for Prof, please put them in the chat. We'll be going through them. Okay, we have a question from Isaiah Usman, and he's asked, what level of effort has the task force made to decriminalize suicide in Nigeria? And has any bill been passed at the legislative?
Okay. Kristen, can I request that we go into the panel and then we
Yes.
can take all the questions at plenary?
Okay, no problem.
Yeah, and that particular question, somebody from the task force can take it. Thank you so much.
Yeah, thank you.
You're muted, though.
Sorry, pardon me. I will be going into the panel session now. And I'll be introducing our panelists, just ensuring that they're ready to go. So our first panelist that we'll be introducing is Gift Anyonu. Just wait for her profile to come up. Okay, while we wait for Gift's profile to come up, I'll tell you a little bit about her from what I know. She's a youth counselor at Mentally Aware Nigeria, or MANI. I'm sure a lot of us have heard about them. She's a purpose-driven professional. She's passionate about innovation, personal growth, and mental health. She works directly with young people in navigating mental health crises and recovery. And she holds a first-class degree in guidance and counseling from the University of Abuja and is an alumna of the Draper University, Silicon Valley, with completed executive training. Ooh, Secretariat, if we can. Okay, thank you. Thank you. With completed executive training from Lagos Business School, Gift's work spans marketing, youth development, and life coaching, and she's committed to helping individuals and early stage founders grow with clarity, confidence, and strategic direction. Gift's journey reflects a blend of emotional intelligence, leadership, and continuous self-improvement, making her a strong advocate for meaningful impact and transformational growth. If you can please give Gift a virtual round of applause while we prepare to introduce our next panelist, who is Mr. Adeshola Oladeji. So Mr. Adeshola is a Nigerian youth leader, mental health system strategist, and an entrepreneur dedicated to advancing accessible mental health care for young people. He's recognized as one of Nigeria's emerging youth pioneers in mental health advocacy. He champions the integration of mental health into primary and public health care, advocating for it to receive the same priority as HIV and tuberculosis. He contributed as a stakeholder to the contextualization of the World Health Organization's Mental Health Gap Program for Nigeria, supporting efforts to strengthen evidence-based mental health care delivery. Through his leadership and collaborations with NGOs, development partners, and local and international government institutions, he has designed and supported initiatives that improve access to quality mental health care for underserved communities. His work bridges policy, technology, and system strengthening to create sustainable impact, and he is passionate about youth development. Can we give another virtual round of applause for Adeshola? Okay, so I'll open the floor up to our panelists now. And once again, to our audience, those of you joining us, if you have any questions that you'd like to ask our panelists or anything you'd like to say to them, please go ahead and put this in the chat box. We'll be monitoring it. Over to you, Gift. If you can just give us a brief, insight into how your work kind of intersects with our topic today, please.
So thank you, everyone, and good afternoon. My name is Gift, as mentioned by Christine. So my work and what we're talking about today is quite obvious. We are the youth, and it is very important that we also know that over 60% to 70% of the country's population are the youth between the age of 18 to 35. So in most cases, what I do is still centered around this topic. How do youth react to challenges as it concerns attempts to suicide? It still boils down to conversations like this. In fact, the underlying factor as to why there should even be suicide attempts in the first place. So it is quite important and very nostalgic to me in this case. Yeah.
Yeah, thank you for sharing, Gift. Mr. Adeshola, if you're still with us, if you can let us know a little bit about your work and how that intersects with our topic today. Okay, I think we've lost him a bit. Okay, you're here. Lisa, go ahead.
Hello, can you hear me?
Yes, we can.
Okay, please take the question again. I lost you for a second.
Okay, I said if you can just tell us a little bit about how the work you do intersects with our topic for today, as we're talking about the decriminalization of attempted suicide and how you can lend their voice to that.
Oh, okay, I see. All right, so hi everyone. My name is Adeshola. I think this particular topic is something that I have personal experience with and a personal interest in because I'm someone that I've struggled with suicidal ideation in the past over the course of my life. And it's so beautiful to be at a point where we're actually having this conversation at a national level. Because so many years ago, when all of this started, when I was going through all of this, when I was struggling with this, the mere word or utterance of the word suicide seemed like an abomination in society, seemed like a forbidding word in families, seemed like a sin in religious households. But the fact that we're here today is such a proof of work of all the work that's been done the last couple of years. And I really want to first celebrate everybody on the call, and I want to say a round of applause to each and every one of you, because without all of us doing this work, we wouldn't be here today. Now, looking at the work I do, I love to work with young people. I'm a youth advocate and a youth focal person for the mental health program for under the ministry. But outside of that, I've taken the youth voices to areas like HIV programming, started going into tuberculosis and sickle cell, because I understand that as a young person, I have the energy, I have the motivation, I have the drive to lend that energy and voice is what I love to do. And it's been something that I've been on this journey for the last 10 years of my life now. And I can say that I have interacted personally one-on-one with over 400 individuals, 400 young people. We're saying male, female, students, people in secondary school, people struggling with depression, anxiety, people struggling with substance addiction and abuse, people even ideating about suicide. I have had one or two face-to-face close calls with people that were literally about to attempt to end their life right in front of me. And it's taught me so much about what it means to be a person, the struggle that comes with being a human being. And that's why I love that we're at a point where we're starting to see this entire thing as this is something this person is going through. They're a victim, not a criminal. They deserve help, not to be persecuted. And I love that that's why we're here. So I really look forward to the conversation moving forward. I just thought to share that. Thank you very much.
Thank you for sharing. Thank you for sharing that. So we'll go on to our questions. Like I said, please, to those of us listening, if you have any questions, any concerns, any comments for our panelists, you can go ahead and put that in the chat box. Our first question for today will be going to Miss Gift. And our question goes, in your experience from the work that you do, what protective factors have you seen actually work for young people before they get to a point of crisis?
So can you hear me clearly? Can you hear me clearly?
Yes,
Okay.
Yes, please go
So
ahead.
some of the protective factors would include number one, support group. I remember when Prof was giving his presentation and he made mention about support groups. They are very important because with support groups, you tend to feel safe because in most cases, people feel like when I speak to my parents or I speak to a friend, the conversations are going to be dismissed, which we've actually seen happen. But when you speak in a support group system, you tend to see people who are willing to, even if they don't have the right information to give to you in terms of professional help, they are willing to listen because sometimes people just want someone who would listen to them vent or share their thoughts or share their opinion or just pour out their hearts. It's not necessarily to the point of suicide attempts. They just want to ease off that pain that is within them. And sometimes it's just a listening ear. And that is what support group brings into the mix. So when there is a place you go to and you feel safe, that is one thing that helps. On the contrary, if that support group is not positively, does not have positive value, that is when the whole thing changes dimension. Say your support group is a group of, say, alcoholics or drug users. Obviously, that would not end well, right? So it is important that even the support group we're talking about is one that has very high moral values that could at least help you, speak to you. And when people get responses from the support group, they don't feel judged. Even when some of the options given to them would be seeking professional therapy or counseling, they don't feel as if this person is putting me out there because they don't like me. They truly know that this person cares. Maybe that person has even gone through therapy or counseling and they are sharing their own story and telling this person, this is how I went from point A to point B, and this is the kind of help I got. So they feel safe, they feel valued from support groups, and they are willing and ready to take the next big step by talking to a therapist. Thank you.
Yes, thank you very much, Gift, for sharing. You mentioned having a listening ear and feeling safe and valued in the support groups that they have with positive values. I don't know if we have any other questions that we want to put in the chat or any of our other panelists would like to jump in at any point. Please feel free if you feel like you have something to add. My next question will be to Mr. Adeshola. Um, so from your experience, what would a real functioning channel for youth input in this reform and in the reform for the decriminalization of attempted suicide actually look like? What would real functioning channel for youth look like in this reform?
I think that's a very beautiful question because it touches on the entire. Okay, we say there's a gap. We say, okay, what young people? So, what exactly are young people supposed to do? And I'm sure we have so many young persons on this call that are wondering, okay, I'm a young person. I want to join this fight. I want to be a pillar of support to my community. How can I do that? The first step is recognizing that this problem exists first. Just barely 24 hours ago, I was having a conversation, inviting someone to attend this webinar. I believe they are here on this call somewhere. And we're having a conversation. They were like, okay, also a young person. And they were like, okay, what's the webinar about? So I had to explain that. Do you understand that right now in Nigeria, attempted suicide is a criminal offense? As the professor said when he made his presentation, it's very mind-boggling that we're at a point where if someone survives an attempt to end their own life, instead of getting them help, we're taking them to courts and to prison. But as a young person, the first thing we can first recognize is, okay, this thing is the situation. This thing is the problem. That's the first end. Then we can now start thinking of What can we do? How can we join this conversation? Just like I and the other panelists, as well as the moderators are here as young persons, this is our own contribution towards this fight. And in certain areas and parts, in our step down communities where we all are, there's still so much work we can do. It doesn't necessarily have to trickle down to the national level. It doesn't necessarily have to be part of some big team. You can be someone that, as a pillar of support in your community, if you find someone that you feel like this person is going through things, they're depressed, and you're worried about them, it's always really good to have that conversation of, hi, how are you doing? What's going on? Would you like to talk about it? And then you can find referral pathways to get this person professional help, professional support. And if you would want to take this a step further, it will always be best as young people, because we have such a huge gap in population in terms of numbers, in terms of professionals versus the affected population. We don't have enough professionals in Nigeria that can actually bridge this gap. Or as young people, we can get ourselves positioned and have our capacities built to become competent, to offer support to our peers. And what can that look like? There are certain trainings we can do, programs, certification courses we can do, like mental health first aid, which can teach us and give us that ability to provide this support. And going back to our own individual platforms that we're on, social media, our audiences, we can raise our voices to share awareness that, dear fellow young people, are we aware that this thing is actually a crime? The fact that someone might be struggling and they might want to end their life is a crime in Nigeria. We can become advocates in our communities, in our different platforms. So I think it's about understanding how we can come together as young people, no longer operating in silos, in individual silos, but coming together to lend our voices, whether leveraging on our social media platforms, as I said once again, and our networks. Because the way this fight is going to work is, if I'm shouting where I'm at, you're shouting where you're at, and everybody's raising their voices towards this good fight. So I think that's it. Thank you.
Yes, thank you very much for sharing, Adishola. One of the things you said really resonated with me, because I think oftentimes as young people, when we see something that maybe isn't going right in Nigeria, or something that we think should be changed in Nigeria, we see it as a them problem and not an us problem. And so it limits how much change we're actually able to enforce and promote. But when we start to see it as something that we can also promote the change of, and we can also act to change, I think that really changes the narratives, and that's when we actually begin to see the change happen. Thank you for sharing. So, Prof. Atilola, my next question goes to you, and it would be that how many young patients, families that you've seen hold back from care out of fear from legal consequences? And in your experience, what has been the cost for them from doing this? So I'll repeat my question, sir. It's how many young patients or families have you seen hold back from receiving care because of the legal consequences, and what has been the cost to these individuals or family?
Okay, I believe that question was for me, right?
Yes,
For
Prof.
for Professor, right?
Yes, was for the professor.
Please go ahead.
Okay. So thank you very much. So it may not present directly the way the question has been asked, but we have seen a lot of people who have called us in relation to their sons and their daughter, and you could tell in the hush way in which they wanted to discuss with you that they are afraid of something. And when you ask them that, what are their fears? They usually mention the fear of stigma, as well as the fact that they are afraid of police involvement in in a case of attempted suicide. We have seen quite a number of it. In fact, I work in a public hospital, and I also have a small private practice that I run. And I've seen people that cannot afford private practice, but insisting that they rather will go and borrow the money so that they can come and see me privately than come to the public hospital because of fear. And then you ask again, what is the fear? the fear of stigma, the fear of the fact that they will bring a matter that is potentially criminal into a public domain. They rather want to do something that is a little bit private where they can come in and then they can go out. But a lot of time, these are not people that can even afford private services. So they are not even able to come for the appropriate follow-up and what care the person will need because of the fact that they can't afford it. And when you encourage them to come to public place, they tend to be a little bit skeptical about it. There are also been reports of cases where policemen have come and meet a psychiatrist to argue that they learned that you took care of someone who attempted to kill themselves in this your hospital, and they are trying to make a case. Of course, a lot of time, what people are just looking for is some form of maybe extortion of the practitioner. But under that circumstance, even when we have always been able to push back, but the point is that nobody wants to practice that way, where you are concerned about whether what you are doing is against the law, because under normal circumstances, based on that law, you are obliged, if a crime is committed, I'm putting that in quotes now, you are obliged to report if the same comes to your notice. There was a time when, if, we made this pushback also with gunshot injuries. There was a time when you can go to jail if you treat gunshot injury and you didn't report to the police. But because people now saw that a lot of people were dying, because this is a corollary that one can draw. A lot of people were dying from gunshot injury. You have been shot by an armed robber, and the doctor is constrained by the fact that I need to get police clearance before I can treat you. It took a presidential task force to actually issue a directive that now they even turned it now that if you are a doctor and you refuse to take care of a gunshot injury because you are waiting for police report, you can now be prosecuted. Meaning that the table has actually turned to tell doctors that please take care of somebody, prevent them from dying. So the same we apply to no doctor should be, because whether you like it or not, people will still remain skeptical of any matter that is designed as criminal. And there are a lot of people that are not able, including young people, that are not able to get the help that they need. And like I was explaining to someone recently, that it's even worse for young people, because while older persons knows how to navigate a matter that is potentially criminal, young people don't have such resources. And a lot of time, they may just have to recourse to hiding the information. And the more you hide that information, especially suicidal behavior information, the less likely you are going to get the help that you need, the less likely you are going to come out of that situation, the more likely that you are going to make a successful attempt. So, head or tail, whichever way we look at it, it is impairing practice, it is impairing help seeking, it is impairing even being able to provide the help that you can.
Yeah. Yeah. Thank you so much, Prof, for sharing. My next question goes to Gift, and it's based off of what Prof said. He was talking about young people and how sometimes they have issues navigating criminal issues just as a result of lack of resources. And in your experience, have you seen that happen? Have you ever supported a young person facing, maybe the legal side of an attempt, even if you haven't? From your understanding, from your experience, what do you think would have helped a young person who was navigating, the legal side after an attempt?
So one thing that I think would help or have helped, as we've discussed, should be first responders' reaction. And first responders in this case are the family, right? In some cases, family members want to either shield the whole thing, or they do not want to associate with this person. So it could go either of these ways, right? We've had cases too where the family are very supportive. They are helping this person through the whole legal back and forth. helping the person understand that, okay, you're not a criminal, but this is why you have to go through the legal reforms to just to help you understand why the act shouldn't be carried out in the first place, right? But in cases where the family members are not helping that person understand better, that is where the family members are pushing the person into the fire to go take it all up by themselves. It is even difficult to help this person to navigate that system because they don't have a support system back home. When they are done speaking to you as their therapist or their counselor, what do they fall back to, right? When they go home, how are they perceived? It could even lead to another attempt to suicide because in their mind, I'm no longer loved at home. I'm no longer valued. My friends don't see me as they would. It's between me and the law. And if there is nobody to back you up or nobody to give you that support, you really don't want to continue anymore, right? You feel unsafe. In fact, it's even difficult for the therapist to have that communication with this person because they feel like there is no need for this counseling or for this therapy, right? So it is usually difficult when there is no support system from family or from friends because we've seen cases where people just don't want to continue. So they either want to run away from the law and just continue their life elsewhere or just commit the act of sorry, forgive me for using the word commit, but then carry on the act of suicide, even a second time, just to make sure they are done with it. But that's not the best action here. And for me personally, I like to say first responders have to be properly trained. No, it shouldn't just be the victims here, but the first responders who are usually the family members, the religious leaders, friends, support groups. They also have to have the right knowledge as to what to say. You had mentioned earlier the kind of terms we use
Yeah,
to people who find themselves in this situation. How do you speak with them? How do you see them after this act? Do you make them feel less of themselves? You have to make them feel loved. I'm
yeah,
laying emphasis on the fact that they feel less valued. They feel like there is nothing life has to offer to them. But when they go back home or go back to those their circle and they still keep hearing words of encouragement, it is easier both for the therapist. It is easier for them to even go through with the legal consequences and know that when they come out of it, there is somebody back home to still help them do life and help them achieve their best self, regardless of what may have happened in between it. Yeah.
yeah, yeah. Thank you so much for sharing, Gift. I completely agree. Those resources are very important, and sometimes they come in the form of people. Most times they come in the form of people. I'd just like to take some time to just mention to our audience that we do see your questions. We're taking note of them. I've noticed a couple of hands raised. I'm not ignoring you. I've taken note of these. And when we get to the plenary session, you'll have a chance to speak. We just have a couple more questions for our panelists. Then we'll into our plenary session. So my next question is from Mr. Adeshola. And so this will be your final question, sir. So you can go from answering this question to any closing statement you have before we take the plenary session. So my question is, how do young people actually find out about their legal rights? If I can be candid and admit here, I think prior to starting work with the Federal Ministry of Health's National Mental Health Program, I wasn't even aware as a young person that attempted suicide was a criminal offense in Nigeria. It was not a knowledge that I had until we started having those discussions in those rooms. And I find the same with a lot of young people. So, where, in your opinion, do you think that information and how does that information usually fail to reach the young people that it needs to reach? And how can we ensure that that information is reaching them?
Mhm. Okay, I think that's a very good question. And as a young person, I believe I'm allowed to say this to my fellow young people. It's a simple thing. Please consume knowledge. Please learn. Please take your time to do research. Take your time to do things that are profitable and can help you build capacity, build competence, build your knowledge base. It's so important because knowledge is so powerful The only way you can solve a problem is if you can recognize that there's a problem in the first place. And how can you know if you don't pay attention? We live in a period, or yes, a period, and in a world right now where everything is so fast paced, everything is rushed. There's a lot of misguided priorities for young people, as far as I'm concerned. We have social media, we have the internet, we have AI, we have so much going on that we could consider entertainment, we could consider good, that perhaps are starting to do more bad than good. And the point is, how do we actually try to balance our priorities? Because the thing is, we can always say, oh, the lawmakers, the policy makers that made these things, these decisions, all of them are old people, whatever, whatever. It's now our generation, it's a generational gap. Before we know, we'll soon become that age, we'll soon become decision makers. And if we don't have that level of depth, that level of competence, that level of knowledge that these problems exist, when we get to the stage, how do we know what to speak about? How do we know how to fill those gaps? Make friends with people that can actually build your knowledge base and your competence too. As a young person, I believe that every person, every adult, every young person should have a friend that is a lawyer, as far as I'm concerned. Just so that you can get legal counsel, legal advice. You can have like an actual go-to person that can walk you through what your rights are, what you're allowed to do, what the law says about XYZ. I believe so that you can have that level of legal backup in certain points. So it doesn't have to be a
Yeah.
friend, but put those things in place, put those connections in place so that it's not when things get out of hand, that's when you start looking for a lawyer. It's not
Yeah.
when it's that you're struggling with perhaps ideation and maybe you attempt and then you survive and you now find yourself being arrested. That's when you realize that, oh my God, so attempted suicide is a crime in Nigeria. The point
Yeah.
is this: knowledge, gaining knowledge, learning,
Yeah.
so that you can actually know what to do from there. I hope that answers the question.
It does. Thank you very much, Adeshola. It really tells us how much we need to take responsibility to, get that knowledge and not wait until we're faced with certain situations before it comes. So thank you for sharing. Okay, so now we'd like to hear from you, those of you who've been joining us, who have been paying attention. If you're just joining us, welcome. You've missed some very important discussions, but it's not too late. We still have more important discussions to have. But we'd like to hear specifically from you now. So you can use the chat box. I've noticed we have some hands raised, so I'll be giving those individuals an opportunity to speak as well. But in just as something to guide you in what you're speaking to, we have members of the task force who are currently on this call, some lawmakers on this call, and other young people. So what would you want them to hear directly from you? Please use advantage of the group and pardon me, use advantage of the chat. If you'd like to speak, I'll be calling on you. So I'd like to call on the first person, Olubukola. Your hand has been up for a while. I don't know if you have something to share with us. Please keep whatever contributions you have to about a minute so that we can manage our time well and give everybody an opportunity to speak. Thank you very much, Ma. Over to you.
Yeah, thank you so much, Christine, and thank you to our panelists. I particularly would like to say hello to Professor Olayinka Atilola, who finished from the same institution as where I work. My question is actually to Professor Atilola. When we're talking about criminalization of suicide, something keeps coming to my mind. Is self-harm, is self-harm under suicide? And how do we distinguish between suicidal self-harm and non-suicidal self-harm? Is it even a thing? Is there something as non-suicidal self-harm? And if there is, how do we differentiate? How do we help? Because I realize that sometimes some people may not really want to really commit that full suicide, or let me not use commit. Christine said we shouldn't use commit, but they don't want to kill themselves, but they just want to harm themselves. I mean, how do we differentiate? And the lawmakers, did they even know that there are some self-harms that are suicidal and some are not? Those are the questions that have been going through my mind. I don't know if Professor Solela can attempt to please help me. Thank you.
Okay, thank you very much. If I can respond straight away, that when I was explaining earlier, I said that suicidal behavior is actually a spectrum, and it can start from as early as just being tired of life, thinking about wanting to harm oneself without even having any plan, and then progressing to having a plan, and then doing something to oneself. Now, most self-harm, people have tried to divide it into with suicidal intent or without a suicidal intent. But one of the reasons why those divisions are not useful is that anytime you do something to harm yourself, it's a precursor to you doing something that can become lethally harmful. People have thought that just cutting my wrist, I don't intend to kill myself, I just want to harm myself. But people have developed severe infection of the cut site that has spread, and they have entered into very bad septic state, and people have died. So again, for clinical purposes, we try not to separate between whether this is with a suicide intention or without a suicide intention. Doing anything harmful to yourself deliberately is part of the suicidal behavior spectrum. And again, talking about whether the law differentiates between which is which, that is actually the folly of the law, in the sense that it is not even the business of the law. Practically everybody that harmed themselves in some way did so because of a burden that they carry. What we need to be talking about is having established that such things happen where people just find themselves in that state, that can we focus on how do we get help for these people rather than how do we punish these people, whether or not they intend to kill themselves or not kill themselves. Because a lot of time, like we say, it is when somebody have died that we call it suicide. But then every attempt at one's life is potentially a suicide in statistics. So that is it. We don't try to differentiate between this, and the law does not. The point is that the law does not have any business in that arena, because it's not about uh, the individual. It's about the help that they need, and these helps are available and they are
Yeah.
useful. Thank you.
Yes, sir. Thank you for sharing, Prof. You mentioned focusing on getting help to people rather than punishing them. And that is why we're here today, to talk about how we can get help to these people. So, another question that we have in the chat box said, and it's a very, I'm going to throw that out there, please, to any of our panelists if you'd like to answer. I found it a very interesting question. So it says, given the importance of preserving the sanctity of life, what is the appropriate balance between compassion, decriminalization, and deterrence in maintaining social values and equilibrium? I'll ask the question again. Given the importance of preserving the sanctity of life, what is the appropriate balance between compassion, decriminalization, and deterrence in maintaining societal values and equilibrium? So this goes to any of our panelists, Gift, Shola,
I think
Prof.
oh, okay.
Okay,
I
No,
think
this
I've
go ahead, sir.
read that question earlier, and I was just thinking about it because it's a very
yes is in the chat box.
insight. It's a very insightful question, and I understand where that question is coming from. This has always been a conversation whenever we talk about it, decriminalizing suicide, because there's still this part of us that feels that one of the reasons why people are not attempting to kill themselves is because there is a law that says you cannot do so. But what evidence have shown is that the for those majority of people who have suicidal ideas and they never acted on it, I've not heard anyone who have said that the reason why they didn't act on it is because they didn't want to go to jail. So meaning that overall, the issue of criminalization is not a deterrent. I will give an unrelated example. I think one African country, probably Uganda, recently, no, not recently, maybe some 2 years ago, decriminalized what they call adultery. And the whole social media space was awash with conversations about, oh, they said the country has legalized adultery. They have not legalized adultery. They have only said that, look, whatever is happening between a man and a woman, let it be within the civil case realm and not bring it to the criminal court. Now, does that translate to the fact that immediately after the decriminalized adultery, that the whole of Uganda started adultery? The behavior never changed. It is what it is. So criminalization has never been a deterrent. And what we are saying that, but it stands in the way of help. Take it out of the way to help so that we can get the help that we need while the law go and sort out other issues that are more legally meaningful than talking about somebody who is having a mental health issue. So I think that is where the balance is actually. Of course, the conversation is not about let us democratize attempted suicide, let everybody just do their thing. No, what we are saying is that get it out of the way of help seeking. Because the truth of the matter is that if you set up something like an online helpline and somebody called you on that helpline and told you that he was just about to kill himself, and you are trying to talk the person out of it, please don't do that, whatever, and the person actually did that on the call, you are obliged to report. That is a crime and you are a witness to it. You are obliged to go and report that to the police. And sometimes people will now be working on eggshell whenever you are providing a platform to help people who are struggling with suicidal behavior, because you also don't know when you can be arrested to say you are encouraging a crime or you are. So all of these things are not what a mental health practitioner want to help people should be worrying about. That's the point. Just take it out, let the conversation be clean, but not necessarily saying, oh, now we have democratized, which is the thinking that a lot of people sometimes are, which is not valid. Thank you.
Yes, sir. Thank you. Thank you, Prof, for sharing. We'll take Mr. Ayola. You have your hand up in a comment. Please go ahead and share.
Everyone, and good afternoon, everyone. It's such a privilege to share what I have here. I would like to speak particularly to education, or the awareness that was raised earlier. I think every other points were valid, but my question comes from, and I think maybe it goes to the task force, so to say, what's the role of education in creating awareness in this, right? Because I'm trying to remember his name right now. I'm sorry, but he was speaking about how that we need to, step out to get knowledge. Young people need to consume knowledge about, this entire thing, so that when you get to that situation, it might not get to you. So, but the truth is, many people might not even think of that. I mean, people that want to commit suicide in the first place never thought of the fact that they want to commit suicide, right? It's not something that they already are planning for, and they think that, okay, I should go and prepare myself so that in case I find myself in such situation, I know what to do. But I think in many cases we might need to take this thing to them to the doorstep. So what's the role of education? What's the role of awareness? Can we have conversations around infusing these things into curriculums, secondary school, primary schools? You're talking about health education in school, you're talking about mental health, you're talking about health, we're infusing these things as needed or when necessary into all of these things, right? So that we don't keep having to go through all of these phases. So basically my point is just around, education, awareness. Is the task force doing something about this already? If not, how can we, venture into this? I genuinely feel like a couple of, for example, very random, but I think it's necessary, like the NYSC scheme that they're looking at, rejuvenating or canceling the policy entirely. These are things that, young adults as part of national investment and stuff should step into. I remember my very first, so I'm going to wrap it up now. I remember my very first um, awareness or enlightenment into HIV was through core members coming to our school, talking about these things. I never knew that there's anything like HIV. If I had grown up, I didn't have any information. I probably could have stepped into it. But yeah, I really do understand his point about, knowledge and trying to consume knowledge. It's very, very important that you equip yourself with that. But at the same
Yeah.
time, there is a work to be done around it. Thank you.
Definitely. Definitely. Thank you for your question, Mr. Ayola. And if I can respond on behalf of the task force, or if any other member wants to respond, please go ahead. But I'll just go ahead to say that we have recognized the importance of education and educating the public, and not just waiting for them to do it themselves. And we've taken into stock that this needs to be done at different levels. So even if it's at the level of our parents and how to reach them, and then we as the young people, and it's something that we are working towards and are open to working with other organizations that work in the education and the advocacy space to do that, because like you said, it is important to do in the work that we're doing and what we're trying to do at the end of the day. So thank you very much for sharing. Our next question we have is directed to Miss Gift. And so this question, if I provide some context, is just talking about in an ideal situation. So if we think about the fact that, let's say in 6 months or a year from now, attempted suicide in Nigeria has been decriminalized. This person is asking what will be different for example, for a distressed 19-year-old the morning after the law changes. So who will receive the young person? Who will assess them? Who will support the family? And how do we ensure follow-up?
Yeah, so in that situation, first off, the person isn't going back to the family immediately to sleep when they're comfortable in bed, right? Because this is the case of mental health and they have to be duly assessed, just like I made mention earlier, to make sure that there is no cause for alarm again. So it's either they are being taken to a mental health rehabilitation center or institution, as the case may be, to help them, to reassess them and to help them fit back into the society, to also help them navigate the issues that have made them attempt that act in the first place. So first, the morning of the whole thing, they have to go to a rehabilitation center, get themselves assessed. Family members can come in to visit, yes, just to show that support. Friends can come in to visit to show that support and to show that, oh, you're still valuable to us. We want you, we care for you, we love you, we're here for you, we're going to do this journey with you. But then again, the mental health condition of that person needs to be duly assessed, and the underlying factor for why the act was carried out in the first place also needs to be duly assessed so that it will not repeat itself, and to know how family members and friends can come in to help that person through the journey of life going forward. Thank you.
Thank you for sharing. I think it's good to hear you say that, because it shows that you as practitioners what the next step is after decriminalization happens. I notice Mr. Adishola has his hand up, so please go ahead. Oh, we seem to have lost him. Okay, go ahead.
Hello, can you hear me?
Yes, we can. Please go ahead.
I think I just wanted to add to what she just mentioned in terms of, let's look at it in terms of a case scenario type of thing. What happens the next morning when this policy is changed, when it's decriminalized? What happens is we wake up and we know that we've gotten that roadblock out of the way. Because you see, the plan is we understand that there's a problem and there's a gap, which is decriminalization, which is why we're making all this effort to have it decriminalized. But the fight doesn't end upon decriminalization. The next thing is, okay, we've gotten rid of negative policies or policies that we've found to do more harm than good. How do we replace them with more positive policies? What kind of policies would serve better in terms of, okay, if somebody is rescued, maybe they attempted and they survived, as what's the escalation protocol? What should happen? What does the law say? And we're looking at having things like, okay, this person should be mandated to speak to a professional. This person should be able to be paired with a professional, a counselor. So it's to say that there's a roadblock. We are fighting right now to get it out of the way so that we can actually chart a more healthy journey ahead moving forward. So I just wanted to add that. And I think the previous speaker spoke very beautifully about education and everything. And also wanted to add that
Yeah.
yes, I love that, and it's going to be an intersectional fight. We're all going to come together to make all of this work together. So yeah, that's what I wanted to share.
Thank you. Thank you very much for sharing. We have come a long way, and we do recognize that we still have a long way to go. Thank you. So I'd just like to take this time out to say that if you look in the chat, you'll see that the task force has posted some very important free resources that we can use, especially as we're talking about education. So please take the time to download them, share them across your platforms, social media, your friends, your family members. Read them yourself to just understand what the work is that we're currently doing, what we're currently fighting for, and the impact that we hope to make. We'll go into our last couple of questions. If I can ask that our next speaker, please keep your questions to about 30 seconds so that we have enough time to take everyone, especially as we're heading towards rounding up. So I'll ask Zinatu, please go ahead. Like I said, please keep it to about 30 seconds. You're still
You're
muted.
muted.
Can unmute. Yes, thank you.
Actually, this is very important topic, and I was so much happy because this is very well in line with a foundation that I just registered it with CAC, the Zuka Women and Adolescent Mental Health and Education. We have been going through schools and we have been seeing all those things. You see that some problems are not only from the peer groups,
Yeah.
mostly some are from the parents. There is expectation and pressure at home from the parents that you will see they are expecting something from the children to do, or some children will be forced to go and study certain courses and they are expecting to do very well in that courses, which they don't have interest in studying that courses. And also peer pressure also. I heard about someone mentioned about support groups, which is very, very good. And she mentioned that the support group also should have a very well morale. Yes, it is very good and very vital. So I was very happy, and it's a very good thing. And if there is anything here in Kaduna, we have something that if someone is suffering from something, please, we are here for you. We are there. Yes, Women and Adolescent Mental Health Foundation and Education. Thank you very much.
Thank you very much for sharing. It's good to see we're all playing our part in ensuring care for people who are experiencing suicidal ideation. It's just to also remember that there are a lot of risk and protective factors that can influence a person's mental well-being. And I always like to say to people near me, please ensure you're somebody's protective factor and not their risk factor. Going forward into our next question, we have this question that's directed to Mr. Adeshola. It says, what then will be the fate of those who don't have lawyers or connections if they are prosecuted for attempted suicide? How will they get the help they deserve? Mr. Shola, if you can just keep your response as short as possible as we near the end so we can take just 2 more questions. Thank you.
Okay. Thank you for that question. I think that question is a very good question. When I said that young people should try to have like a friend as a lawyer, it's not saying that okay, leverage on nepotism or it has to be by divine connection to get by or survive Nigeria of today. It's just saying that as a young person, you're at a point where you can start to prioritize the right kind of beneficial relationships. You should have I always try to advise my fellow young people that have friends that can help you stay healthy, have friends that can help you stay on the right path of the law and can help you, grow and in terms of be a better person. And obviously friends that can help your business to develop. So when I'm talking about staying on the right path of law, this is where this aspect comes in. I think it's about having the right people in your network on your corner that they can be able to educate you and possibly shed light on things where you might not know, so that you're not always the brightest in the room. There are people that can also pour into you. I think that's the entire premise of that statement. Really, I hope that clarifies that.
Yes, it does. Thank you very much for sharing. This next question is open to all our panelists. And someone has asked, in cultures where suicide is highly stigmatized, how can we encourage open conversations without increasing fear or shame? If I can go ahead and answer before I hand over to the rest of our panelists, I would say that conversations like this are one way, just not making it such a big deal, but also giving the platforms for these conversations to happen is one way we can ensure that we're destigmatizing these concepts and ensuring that care is accessible and providable. Thank you. I don't know if any of our other panelists have anything that they want to add or share.
I think I have something to say. So when I saw the question, I smiled because in my head, maybe because I'm a very strong-willed person, I'm like, the conversation has to go on regardless. And this is because we can't sit back every now and then and say, oh, the society or the cultures don't permit it. So I will not say it. Why not say it? Because in as much as there's stigma, meaning that there are people who are either going through that challenges but don't know how to go about it, right? So conversations can go on as little as, say, first of the person who asked this question, or the person who is in this culture, can easily start conversation in certain places where you can get either one or two more persons that would align with what you're talking about. You just need a support and then it will continue. Definitely you're going to have challenges, but the beautiful thing about it all is that you're not going against the law of the country. Since you're on the right line of action, go on with the conversation regardless. Again, when I saw the question, the first thing that crossed my mind was, I know I wasn't born around that time, but during the time where education was quite new to Nigeria, I know there was a lot of people, so many people, education and religion as well. So many people were against it. So many people didn't want to accept it. But with time, conversations were had, actions were taken. People would still go to church. People would still go to school. Even in a situation where they said female children would not go to school, people still forced themselves to. People took that bold step, and now we are living in those bold steps people had taken, right? And I think the same thing should be repeated in this situation. It's not going to be easy, but it takes one step to count a million. Yeah, thank you.
Thank you very much, Ms. Gift, for sharing. There's actually a very interesting conversation currently going on in the chat. I'm sure that those of us who understand the cause will also know that not everybody actually agrees with the fact that attempted suicide should be decriminalized. We have a comment in the chat that says, discouraging suicide is needed, not decriminalizing. And I'd just like to hear our panelists' thoughts on this, because there's actually someone else in the chat who agrees. And like I said, I've come across people, I've met people who actually, think like this and who actually believe that what we need is discouraging and not decriminalizing. So I just like either of our panelists, any of us, to just speak to this. What would you say to this person?
Okay, can you hear me?
Yes, we can hear you. Please go ahead.
Okay, so I think it's important to very clearly state that when we say we want to decriminalize suicide, we are also, to use the word in the chat box, we are not encouraging it. That's the most important thing we can put out there and we can say in this conversation. We are not advocating for people to be more pro-suicidal. We're not advocating for people to harm themselves or end their own lives. We're not advocating for anything of the sort whatsoever. And I can say this categorically as someone that I have been a mental professional for the last decade of my life, and I've been someone that I have attempted and I've ideated about suicide, right? The policy or the law doesn't necessarily restrict anybody from attempting. It just restricts them from speaking out should they survive. What we are trying to do right now is we're trying to bridge that gap that can have people even speak out before attempting, and also even after they have attempted and they have survived, they should be able to speak out freely without fear of legal persecution or consequence. So it's very clear. This is not saying we're trying to advocate or encourage this behavior, or we're trying to say this is okay and we want people to do this. We're trying to remove the obstacle blocking the people that are going through this from speaking out. So this is not encouragement. This is actually in its own right, it's its own way of protecting these people. It's in no way of being there for them. because we are just trying to do just that. So it's very important to say that this is why we're doing what we're trying to do. The reason is very important. So let's try not to forget that. Thank you.
Yes, thank you, Adishola, for sharing. I know Prof has, reiterated this time and time again, especially in this conversation that we've been having. And decriminalizing is not necessarily legalizing. And we'll take this time again to just mention that, please, if you're feeling triggered by any conversation,
Oh my God, what? Okay. Yeah, hi.
Okay, please go ahead, ma'am.
Yeah, no, so just quickly to that question, because that's one of the major reasons we're having this conversation. We know that not everybody agrees, and we want to have open conversations where people actually come and say, we don't agree, and then they listen. We're hoping that you have an open mind and that you listen to what we have to say. We have some resources in the chat. I think some people are not able to download it, so we're trying to place links so you can open it. The task force has developed a white paper. The white paper goes through the pros and cons and all of that in very accessible language that enables you understand the reason why we have to decriminalize. Also tells you what other countries, other jurisdictions have done and are doing in this regard, and hopefully that helps you to come to the place that we are. I believe that even Professor Tilola, when he made his presentation, made it very clear. We, for example, at CHILD, we've done work, we've gone to court to actually get people released, discharged because they have, attempted suicide. We had a young man in one particular case. He had lost his job. This was the job that brought him to Lagos. He was hoping to save some money to go back to school, and then he lost his job and he attempted suicide. And it was the hospital that reported him because they felt it was their responsibility to do so after treating him and getting him better. And he was locked up, and we had to go and get him out. The point of that is that we have emphasized it over and over again. It doesn't stop people. There are people who don't even know about the law, so they're continuing to attend. There are others who know about the law and who said, so that means when I try, I have to be successful so that I don't have to face that. In any case, like I said, the task force has developed this white paper that goes through the back and forth. There's also a fact sheet. This is just 2 pages, so you can read that. Please, comms team, help us. Let's have the link up so that people actually have that information, very well researched and documented information that expresses in very simple terms the reasoning behind the push for decriminalization. Thank you, Christine and Alan.
Thank you, Ma. Thank you very much for sharing. There's a comment in the chat that I'd like to read from Alexander Comfort, and it says the policy of criminalization is never to not complete or attempt suicide. It's just saying if you survive the attempt, don't mention it. Nobody should hear about it. And that's really where the bottleneck of care lies. We want to get care to these individuals. And if we're telling them, don't talk about it if you don't want to go to prison or don't let anyone know, how can they access care? How can they reach this care? So like Professor Chilucci said, we're not at all opposed to differing opinions. In fact, that is what we want. We want to hear, and I encourage everybody here on this call today to actually, speak with people who don't agree with you so that you can help them understand why the work that we're doing and what we're working towards is important. We don't want to become an echo chamber because then we're not really doing the work that we need to or getting our ideas out there and doing the advocacy that we need to. So please go ahead, continue to have these conversations so that we can make it happen. Unfortunately, we've come to the end of today's very interesting discussions. Before we close, I'd actually like us to please take a group picture. If we can all, if you're able to, or you're in a place that you're able to turn on our cameras so that we can take a group picture and just, put this moment in history. What do they say? Immortalize this moment and immortalize this conversation that we've had. So if you can please unmute our cameras, if you want to pose, like Adisha that has a peace sign up, which I've heard is a very millennial thing to do. So I don't know, it's not giving Gen Z. But please If you would like to pose, okay. So I'll count down from 5, and then we'll take the picture at 1. So please turn on your cameras. If you go 5, 4, 3, 2, 1, and pose. Thank you very much, everyone. Okay, to the comms team, we have a comment in the chat that says the documents are not accessible. Please, we'll go ahead and send them. If you're unable to download them, I think we have email addresses for those of us who registered.
We have, yeah, exactly. Thank you so much.
After.
We do have email addresses, including the link to this webinar, should you want to go watch it over again. So long as you registered, you will receive these documents. We'll make sure that we get them to you. Thank you so much.
Yes, thank you very much, everyone, for joining us today. We heard. Sorry. Okay. We heard from 3 vantage points today. We heard from the clinical perspective, the counseling room, and we heard from advocacy and the implementation table. And we all agree that decriminalization is necessary, and it has to be matched with prevention that reaches the young people early enough. And with young people at the center of that work and not just standing at the margins waiting for it to happen. So thank you to everyone who joined us today. Thank you to our panelists. Thank you to our task force and the chair of the task force, all the members of the task force. Thank you everyone for joining us here today. If today's conversation raised anything for you personally, we'll put up the details once again so that you or anyone you know or you need can access care that you need. Thank you very much for joining us, and have a lovely afternoon.
Thank you.
Everyone.
Hello, Dr. Joe. We should have called you in. No?
Our next webinar.
Yes, please. Our next webinar will be in a month, and you will get information regarding that in your emails for sure.
Okay. Thank you, everyone. Gotta go. Thank you so much. Great meeting.
Thank you, Dr. Joe, for joining us all the way from Brazil.
Yes, please wave to Dr. Joe.
Well done.
Yes,
Thank you.
we don't know what the time means there, but thank you.
Thank you, everybody, for joining in. Please continue to engage on all our social media platforms.
Can we have the contacts of the webinar so that we can consult afterward, please? I mean,
thanks to all the speakers, Professor Atilola. Thank you.
Okay, please follow us on our web, and you are going to get an email. Please, you can respond to that email and so on. Follow the task force on different social media websites, and please respond to the email. We monitor it, so any extra question that you have will be answered. All the resources that we mentioned will also be sent in the email. Thank you.
All right, thank you, ma'am.
Thank you so much. Thank you, sir. Thank you so much, Christine. That was brilliant. Thanks a lot.
Thank you. Thank you, everyone, for joining. Thank you, Professor.
Thank you to our distinguished speakers for your passion and your insights, your brilliant insights. Thank you, Prof. That was a very, very awesome presentation, very accessible, very easy to follow and understand. And I think just in the chats, you can see how much everybody really engaged with it. Thank you so much. And yeah, Adeshola, Shola, thank you so much for your passion for this space. We look forward